Welcome back, guys, to Move with Dr. Mike. My name is Mike Ochoa. I am a physical therapist. And so today what we're going to talk about is some of you maybe have just left the hospital, or maybe you haven't left the hospital and you've noticed that over time you feel like you've been losing a little bit of strength. I'm going to provide you guys with some simple exercises that you can do laying down in the bed that's going to help you build that strength back up to hopefully advance you to some more standing exercises, okay? So we're going to jump right into it. The first exercise that we're going to go over specifically to train the core muscles is going to be a pillow pushdown. Now you might have not heard this exercise before, but let me show you what we're going to do here. We're just going to use another household pillow that we have, and we are going to lay down in a hook line position. So all that means is that our feet are up, our knees are up, and that pillow is just going to rest across our thighs here. Now this is one of the best exercises that I like to actually give to patients that are suffering from low back pain, specifically because they have forgotten how to facilitate the core muscles. So this is a great way that we can use our arms and our legs to incorporate those core muscles again, okay? So hands are going to be flat on the pillow, preferably with the arms extended. And what we're going to ask you to do, we're going to try 5 repetitions. And using your hands, you're going to push your hands into the pillow as the pillow is also squeezing into your thigh. And what you should feel is that entire midline, trunk, core muscles, whatever we want to call it, actually start to shake. And that's a good sign. That means your muscles are working. And so we're holding it there, and we're going to try to hold for about 5 seconds. And the reason why we do that is it's because it's called an isometric contraction. And all that means is we're trying to work on facilitating the muscles so that they can wake up, okay? And so after we're done, we're going to relax, and we're going to try again. Hold for about 5 seconds, 2, 3, 4, 5. Remember, I'm pushing down with my hands into the pillow, trying to keep the elbows nice and straight while I do this, okay? So 5 repetitions there. The next one we're going to work on is windshield wipers. And the purpose of the windshield wipers is to work a lot of the trunk muscles that are responsible for rotating your hips, okay? So we got our transverse abdominis muscles, we have our obliques, we even have our hip muscles. And I like this one because it gets patients to really think about the same pattern that they're gonna need when we're rolling over in bed, okay? So we're going knees side to side. You can get creative with this one. So you can go feet together, knees together, and make it kind of like a symmetrical movement. Or if you want to incorporate more of hip mobility, you can separate your feet and still kind of work the same motion. Once again, we're working on repetitions. We're going to go 10 here, side to side of the windshield wiper. Just like that. Perfect. Next one, we've all have heard of a supine bridge. Many times when we are asking our patients to do a bridge in the bed, their beds are so soft that their feet dig into the ground and they have a hard time lifting their hips up. So I have a little trick for that. We're going to use our old anatomy and gait analysis books from PT school. And we're going to set them at the bottom of the bed because this is where our feet is going to be placed to allow us to get some leverage as we're bridging up. Okay, so these books, they're about 2 inches tall. It doesn't matter whether they're an inch and a half, 2 inches, whatever is easier for you. But essentially, they're giving me a flat surface so that I can have something to push against versus just sinking in the bed. Hands are going to go down at my side. If I want to use my hands, I can. What I'm going to work on is really creating that what we call posterior pelvic tilt, okay? I don't want us kind of using our lower back muscles to bend in a lordotic position here. We actually want you to think about really trying to keep that back nice and flat And before we initiate the movement, we squeeze our butt and we're lifting our hips nice and high, trying to get our hips as high as we can to the ceiling, and then we're lowering back down. We never just want to go super fast. We always want nice, controlled, quality movements. You're going to feel your glutes, your hamstrings, maybe even your calves working with this exercise. And we're going to do about 10 repetitions here. Okay. Very good. So after the 10 repetitions there, we are going to move on to a sideline clam. I love the sideline clam. One of the top exercises that can be used to strengthen a lot of the hip muscles here. We get a lot of even just high advanced athletes doing this exercise with resistance, but we're going to choose not to use resistance for today. We ensure that we have a good position at our neckline here. And your knees are going to be stacked, your feet are going to be stacked, okay? And my knees are kind of in a 90-degree angle, or actually 45-degree angle. So my knees are not at the level of my hip, but also they're not straight up and down. I'm actually at an angle here. And what I'm going to work on is bringing one knee up towards the ceiling. And what I should be feeling is a contraction of the hip so for instance, in this side, I'm working my right side. I should be feeling this on the back upper end of the glute area. The way some patients tend to cheat is that when they're doing this, they start to raise that knee up and then they go too far past their limitations and they start turning their body or even turning their entire waistline. But we want you to try to stay stacked so the motion is only at the hip. So slower and controlled is better here. And after about 12 to 15 repetitions, you're really going to start to feel a burn here. Okay? We call this a hip clam, and then you would just switch to the other side if you wanted to work the other hip. Okay? Very good to start to get us ready for walking, especially to make sure that those hip muscles are ready to take on our own body weight. Okay? The last exercise that I love the most, we're still going to be in this sideline position. We call this a modified plank, a side plank. And the reason why I love this is because when I go up and I teach somebody how to get out of bed, as their legs are swinging up, they're actually using the strength of their core, the core muscles on the side of their core here, and their elbow to post up to push themselves up to a sitting position. Even same with lowering down, right? We never want to just kind of flop down like this, right? We always want nice and controlled where we're lowering down. And so this is assimilating that same pattern movement of teaching you how to get out of the bed. Okay, so you would simply post yourself up in a sideline position. We're staying active through the shoulder. We're not letting our shoulders sag, and we're not like kind of twerking our neck like this. We're actually trying our best to keep our body as aligned as possible. And you should feel a lot of the abdominal muscles on your left side working really hard. You can choose to keep your hand resting on your thigh here, or even here if you need a little bit more support. But we're posting up on that elbow, and we're trying to hold here for about 10 to 15 seconds. Taking some deep breaths, and you'll feel yourself really start to shake. That's when you know it's working. And you're gonna hold there for about 2 or 3 repetitions. So you'll do 2 on one side and then 2 on the other. Obviously, these are with rest periods. And so that's gonna really help you with your ability to start to push yourself up from the bed there. Okay? So just to recap and a review, we have our pillow pushdowns. All of these exercises are going to be performed starting off with 1 set at a time. And as you get better with them, you can start to build into 2 sets or 3 sets. So recap, pillow pushdowns, we are going to be doing 5 repetitions at a time. Also, when I was pushing down and holding for 5 seconds, then I was relaxing. So we have a 5-second hold on the pillow pushdown. Then we have our windshield wipers. I believe we talked about 10 to 12 repetitions in that motion there. We have our supine bridges, once again, 10 to 12 repetitions. Our sideline clam, a little harder exercise, but we still want to stick with 10 to 15 repetitions on each side. Once again, if you're sore from this, start off with one set, and then as you get stronger and you develop more control, you can build in your second and third set. And then the last one, where we're posting up on our elbow, we call it a modified side plank. Very good for core control. Working on both sides. We're holding and starting off with 10 to 15 seconds, and we're doing 2 to 3 repetitions on each side, okay? Those are some of my top bed exercises that I like to prescribe for patients. Try them out. Let me know what you think about them, how difficult they are for you. And if you found value in this video, please feel free, give me a like. If you don't mind, give me a subscribe. And let me know what you think about the content. If there are things that you want to hear about and you'd like for me to cover, I'm more than happy to get on that. My goal is to provide input and education to the aging population so that they have somewhere to look and turn to when they want to stay strong, mobile, and independent. Thanks again. This is here with Move with Dr. Mike. Have a great day.